Hi, welcome to MyCounselor.Online. I'm Tori, and this is Asking for a Friend. Today, we're going to sit down with licensed therapist Josh Spurlock and talk about the differences between a psychiatrist and a therapist and whether or not you should go see one. Stay tuned. Hey guys, welcome to Asking for a Friend. I'm Tori, and I'm here with Josh. Hey Josh, how are you doing?
I'm doing great, Tori.
Awesome. Well, I have a question today from Jack, and Jack asks, how do I know if I should see a counselor or psychiatrist?
Yeah, that's a really good question. Psychiatrists, psychologists, therapists, it can be kind of confusing as to what do they mean? Is it that I need to work with? How do I know which one to set up an appointment with? So let's just talk for a minute about what the different titles mean. I think that'd be helpful.
Yeah.
That a psychiatrist is a medical doctor. They're an MD. They went to medical school. They graduated from medical school, just like your primary care physician or surgeon or any other medical doctor that you would go see. And then they specialize in psychotropics and medication management that is specific to the brain. And so that's their area of specialization within the medical field. And it used to be a long time ago that psychiatrists would do therapy also. And so they would do counseling and therapy, and they would prescribe medication when necessary or when it would be helpful to the counseling that they were doing. And they would combine those practices together. In modern times, that's not really how it's done anymore. That psychiatrists are really limited in supply. And so their days tend to be completely full with just medication management. And so what they do is they assess the situation to determine if a medication is called for. And if so, they prescribe that medication and set up a follow-up appointment for you to come in. The experience today of meeting with a psychiatrist is very similar to meeting with like your family physician, that you come in, they'll ask a few questions. Before you get in the session, a nurse will take vitals and that sort of thing. And then they will write a script to you, give it to you, and set up a follow-up appointment to see how the medication is going. That's what it's like for engaging a psychiatrist. And sometimes, depending on what is going on with you, you may need some medication management, and a psychiatrist may be a good option for you to connect with to do that. A lot of times you can also get some assistance through your primary care physician for most medications, and your primary care physician can be easier to get into than with a psychiatrist. Counselors are a totally different story. And so psychologists, licensed professional counselors, these are individuals who do therapy. You come to them, and in most states, they don't prescribe medications, that they will meet with you and do an assessment as to what it is you're experiencing and plan out a treatment of counseling to address those needs, which sometimes may include referring you to a psychiatrist or your primary care physician to see if medication is called for in your situation to help with the therapy. In all cases, if you go to a psychiatrist, you go to your primary care physician, you get prescribed a medication for dealing with, say, depression or anxiety. If you read the label on that medication, it's going to tell you that you need to do counseling in conjunction with that medication, because the medication is going to address the symptoms, but not the life effect that either caused or is an effect of the situation that you're dealing with. So that's kind of the scope of what those things are and under what situations you would want to be plugged in with each.
Yeah, absolutely. And they're both equally important. They're both so important. And, such gifts that we have that, both ends, medication and the licensed professionals that we have now to talk through the things that we're going through, to give advice, to listen. I think they're both just so important. And we definitely want to feel taken care of. We want to feel safe with who we're talking to and who's prescribing us medication. So I think that they're both so important.
They really are, because there are some things that we're experiencing in life that have a real biological origin to them, or influenced heavily by a biological component. And if we don't address the biological component of it, we'll find that therapy gets stuck. And we just kind of spin our wheels because we're bumping up against something that's chemically happening within the brain and within the body, that if we don't address that, we're not going to be able to get through. And so, in certain circumstances, there's just an absolute need for it. And most of us, myself included, don't like taking any medications that we don't need, especially ones that involve our brain.
Yeah.
But our brain is an organ like any other organ in our body, and it
Mhm.
sometimes needs some help from medication.
For
And,
sure.
uh, and while I don't like wearing these glasses in here, I'm thankful that they're available because I like to be able to see you. And I count it as a gift and a blessing that the Lord has made it possible through science and medicine for me to put these on and to be able to see you clearly, even though they can be obnoxious. And I'd rather not have to be wearing them if I could avoid it.
That is a really good way to explain it. Awesome. Well, thank you so much for your question, Jack, and for your answer, Josh. I think it's an answer that a lot of us are looking for. Thank you so much for watching. We love answering your questions. If you have a question for one of our therapists, go to MyCounselor.Online/ask.